I have yet to find another program that brings as many experts to the fore to help train future leaders in health equity as the Pozen-Commonwealth Fund Fellowship.
I think about healthcare as a mission, as something that we need to find the best way to provide to everyone. But it's a business, and most people, many people in leadership roles in healthcare are thinking from a business perspective. So we need to bring both together, the health equity framework and the business concepts.
Thinking about what might be the return on investment on programs that address food as medicine or understanding trust and community partnerships. I could not figure out how to scale these. What I got really interested in was thinking about, an MBA could help me think about how to make greater impact.
As a medical student and even as a resident and fellow in clinical training, there are certain skills that were just not taught, and I wanted to be able to really equip myself to be able to address some of the challenges that I was seeing as a clinician.
The Surgeon General, for example, I had the privilege to ask questions and get to know better during this time. Commissioners, health servants, and CEOs, and it's just like I can't believe how many people I have met during this program that help actually understand health equity much better.
Even in courses that I wouldn't think that there would be a health equity or diversity, equity, inclusion component, there was. And what that means to me is that Yale EMBER program really takes this seriously. I was really surprised that I was able to apply inequities, for example, in my statistics class, as well as thinking about how do I apply these concepts in my healthcare economics class, for example.
One of the things that I've come to realize in almost 2 decades of practice is the need to really have people who are decision makers and policy leaders who are trained on issues related to minority health leadership and policy.
We are committed to creating that generation of leaders in health equity. Our fellows can come here to do our EMBA program while they maintain their employment at their current job, while they continue to be deeply invested and involved in health equity, locally, nationally, on a global level as well.
So what I'm learning here would, immediately reflects to what I do in LA. And I know that it's the same for all the other fellows.
I now have a family of supporters, of allies that understand these issues and keep me encouraged when times get hard.
Created a new network and brought new ideas to me that I didn't imagine were possible. I brought those back to my work during the program, implemented and applied them in real time.
It's helped me be a better leader. Seeing a business school that puts society in its mission is very both surprising and refreshing.
I take the precepts of the Hippocratic Oath really seriously, and especially the line that I shall provide for the benefit of the sick all measures which are required. Increasingly, especially with healthcare reform, we're starting to see all measures, moving from the exam room to the boardroom, to the halls of government and other places. It's really there that I think that the largest changes to health equity are really going to be realized.
Having that ability to think differently, understand the business imperative around healthcare, understanding all the different players and how they're affected, is something that will help you have a broader perspective of the work that you want to do to be able to, at the end of the day, help your patients.